Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss the study of therapy duration and improvement of ventricular function in de novo heart failure, the Heart Failure Optimization Study, which was published in the European Heart Journal in June 2024. In the Heart Failure Optimization Study, HFrEF, researchers sought to understand how much the left ventricular ejection fraction, LVEF, improves beyond 90 days in patients with newly diagnosed heart failure with reduced ejection fraction, HFrEF. The study was designed as a prospective, multicenter observational study. Patients with de novo heart failure with reduced ejection fraction, HFrEF, and an LVEF of 35% or less were enrolled into a 90-day registry phase. During this time, they were equipped with a wearable cardioverter-defibrillator, WCD, and received guideline-directed medical therapies, GDMT, for heart failure. The optimization of these therapies was left to the discretion of their clinicians. After the initial 90 days, those who continued wearing the wearable cardioverter-defibrillator, WCD, were followed for up to 360 days. LVEF was measured at the start and then at 90, 180, and 360 days. The primary goal was to determine the proportion of patients whose LVEF improved to more than 35% between 90 and 180 days. Out of 1,300 patients who started in the registry, 598 moved on to the study phase, with a median initial LVEF of 23%. The cohort included 27% female participants and 58% with non-ischemic cardiomyopathy. By day 90, 46% of the participants had an LVEF above 35%. This proportion increased to 68% by day 180 and reached 77% by day 360 among those with complete data. High rates of guideline-directed medical therapies, GDMT, were noted, with beta-blockers, ACE inhibitors, angiotensin-receptor blockers, angiotensin-receptor, neprilysin inhibitors, ARNI, and mineralocorticoid antagonists prescribed to 97%, 94%, and 62% of participants by day 180, respectively. Achieving target doses of all three drug classes was associated with an LVEF improvement of over 35%, highlighting the importance of optimal medication dosing. The study also recorded low rates of ventricular arrhythmias beyond the initial 90 days. Specifically, during the first 90 days, 24 participants experienced 34 ventricular tachycardia or ventricular fibrillation events. Only one instance of non-sustained ventricular tachycardia was observed between days 90 and 180. In conclusion, the study found that 46% of patients with low LVEF at 90 days experienced significant improvement by day 180, particularly among those receiving optimized guideline-directed medical therapies, GDMT. These results underscore the potential benefits of continuous GDMT optimization and suggest that delaying implantable cardioverter-defibrillator, ICD, implantation may be appropriate for selected patients, allowing for further LVEF improvement. However, it is important to note that this study's findings may not fully translate to real-world clinical practice, and further investment in GDMT titration processes is needed. Key takeaways from the study are: 1. Continuous guideline-directed medical therapy, GDMT, optimization can significantly improve LVEF in patients with heart failure with reduced ejection fraction, HFrEF. 2. Achieving target doses of heart failure medications is crucial for LVEF improvement. 3. The rates of ventricular arrhythmias were low in patients who continued using wearable cardioverter-defibrillators, WCDs, beyond 90 days. 4. Delayed implantable cardioverter-defibrillator, ICD, implantation may be reasonable for some patients, suggesting a tailored approach to heart failure care is necessary. These insights emphasize the importance of optimized medical therapy and may influence future strategies in managing heart failure patients. Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.